All right, so we're back in the Snell Library here at Northeastern in an urgent care clinic. Julie is our nurse practitioner student, and she's going to perform an incision and drainage of an abscess on our patient, Jen.
Yeah, so I'm just going to talk through it first, and I'm a student and I really want to do a good job, so if I forget anything, please tell me. So I have my patient here with her abscess. I'm going to collect all my supplies. She's in a significant amount of pain. I have my betadine, I have my packing, I have some scissors, I have a 10 blade. I chose to use 1% lidocaine without epi. I have some sterile gauze. I have clean gloves, not sterile gloves. I have an 18 gauge needle. I have a 27 gauge needle. And I think that's it. I think I have everything I need.
Are you going to give me some pain medication? The one that starts with the D?
So I'm going to numb you, so you're not going to feel anything. You might feel a little bit of burning on my first injection, but we typically only use
so it'll go in the IV, right?
No, it's just going to go right in the top of your skin here.
Oh, I don't know if that'll work for me.
It'll be okay. We really only use the topical numbing things for like little kids and patients with developmental disabilities that can't stay still, but you're staying still just fine, so I think you'll do great. Okay. So first I'm going to clean the area with some betadine, and then I'm going to pull up my 1% lidocaine and inject circumferentially in a ring block technique around the abscess. I'm going to go in at about a 45-degree angle and inject as I pull out until I see the wheel, and then I'm going to try to inject subsequently into the areas that are already numb, so my patient will only feel hopefully one little sting.
Let's hope so.
And then I'm going to test the skin, make sure the patient's numb. I'm then going to use a 10 blade to make an incision down about the whole length of the abscess, and then going to express the fluctuance, and I'll irrigate it with some normal saline to make sure that all of the pus is out and the wound bed is clean. Then because of the size of this, I'm going to pack it with some plain packing. I have 1/4 inch for this size. I'm going to pack it loosely so it's not uncomfortable for the patient, and that will promote drainage and allow it to heal from the inside out. And I'll also just send a culture to the lab, put a nice clean DSD on top for drainage, and the patient can take Tylenol or Motrin when they get home. When the lidocaine wears off, it should last about 3 hours, and it will feel a lot better now that all that pus will be expressed. And Infectious Disease Society of America from 2014 soft tissue guidelines recommend that IND is equivalent actually to antibiotics, so she won't need any kind of antibiotics or anything. She'll just need to follow up in our surgical clinic to have the packing removed in about 3 days. Am I forgetting anything?
You ready for the procedure, Jen?
I think so.
Okay.
So you're a student?
I am.
Have you done this before?
I did in the library at my college.
Oh, interesting.
On a chicken. So you're in great hands. Okay, so my preceptor is here to kind of guide me in case I forget anything.
Oh, good.
So first I'm cleaning with the betadine. Oh, do you have any allergies? Lidocaine, latex, anything I need to know about?
I'm allergic to
Tylenol and Motrin?
Yeah.
Okay.
Morphine too?
Yeah.
Do you need Benadryl?
Extremely allergic to morphine.
Okay. All right, well. All right, so. You can look away, you can put your headphones in.
I like to, I want to watch.
Oh, okay. I thought you
Seems
were afraid
pretty
of
big.
needles.
Oh, just on certain times.
Oh. How did you get this abscess?
I'd rather not say.
Oh, okay. Have you ever had them before?
Quite a few times.
Oh, so recurrent abscesses. You may want to consider MRSA coverage, so I'll look back in your chart to see if you've ever had this cultured before.
Maybe she'll need antibiotics.
You might want to consider MRSA coverage if she's had a history of it before.
Break them.
Break what this?
Yep. Just be careful. I know.
You guys do this?
No.
Oh, this is weird.
We use smaller syringes.
Oh. Okay, so now I'm going to use my ring numbing technique, I'm gonna go just adjacent to the abscess. You're gonna feel a little sting of
Ah.
burn, okay?
Ah.
Okay, doing great. That should be the worst of it. I see my wheel. And then you shouldn't feel these. I'm going into the already anesthetized area. Not too bad, right?
It feels a little better now.
Yeah, okay. Good. I'm just going to the tissue around the abscess, and I'm going to numb all the nerves that innervate into the abscess. It's encompassed in kind of an area of everything is numb. You doing okay?
Yeah.
You're gonna feel a lot better when this is done. And I'm injecting as I withdraw the needle out. Okay, and I'm gonna wait about 2 to 3 minutes. I'm just gonna test the skin. Can you feel this?
Just a little bit.
Anything sharp?
No.
Okay. You feel this? Okay. All right, you sure you wanna watch?
Yeah.
Okay, so I'm gonna take my 10 blade.
Yep. Press it down.
Okay, I'm gonna make an incision about 1/4 centimeter deep.
Whoa. What
That's
is
all-
that?
That's all the pus.
Oh, that was inside me.
It was, it's not gonna come out. I'm gonna use my Kelly clamps to kind of open the abscess.
Ugh.
And I'm just gonna kind of gently squeeze it all out. Yeah, you can see it's kind of nasty. There is a smell. It's bacteria and
does
dead
smell.
skin. Okay, and I'm just gonna open the abscess and I'm gonna irrigate it with just some saline. Thank you. Okay, that's running clear. Okay, great. Still doing okay?
Yeah.
Not feeling much, right?
Yeah.
Okay, so not too
So glad that's
bad.
gone.
And
I hope I don't get another one though.
okay.
What's this for?
So this is a packing, so I can't just close it because you're at a risk of getting an abscess again. So I want it to heal from the inside out, not the outside in. We don't want to trap any of the pus in there. So this will allow it to drain. You're gonna have to make an appointment for a few days to get this taken out. It's called a packing. Okay, I'm just gonna kind of gently fold this in here, not too tight. I'm gonna leave a little bit exposed, and this will promote drainage. You're gonna have to keep this area clean and dry.
So I can't go swimming?
No, no swimming, no hot tubs. You can shower, but don't keep it dry. Kind of keep your arm out. Okay. Shannon, am I forgetting anything?
I don't think so.
Okay, I'm just gonna do a nice clean DSD.
Wow, thank you. You did such a good job.
Welcome. You're a good patient.
All right. Anything else we want to add?
I don't think
Do
so.
you need
So
to send
keep
us
it. Yep,
Oh,
I
yeah, we're
sent
gonna
it.
send to
Yeah,
culture.
so we'll call you in about 48 hours.
Yeah, I
with the
want to know
results.
what it is, what's
Yes.
growing.
All right. Thanks for joining us today.